we're branching out a little here, a little change of pace, because what we're trying to do is bring in other resources for people who are trying to like kind of put their life together.
Like giving people the tools, resources, and know-how?
Yes, exactly.
What are some of the biggest mistakes that you see people make when they're first coming to you?
They were able to save, I don't know, $8,000 or something like that a year. So that's one of the biggest mistakes I see is that.
All right, welcome back to another episode of MillenniUP. As you see here, we have a familiar face, Brian Cannon. Hi, Brian.
Hello. How are you?
Great. So last time we talked to you, we were talking about you and your new home with your wife, Sam. And today we're going to be picking your professional brain about health insurance. So we decided to bring you on. Seth has known you for a while. And because of Seth, I got to know you. And I get to tell at least a little bit of my personal experience because I was the average person who was in need of health insurance. So I guess I'll start with a little bit of my backstory with how I got to know you and how you got into this mix. And then you can tell us a little bit about what you do on the professional end now that we know your personal home buying end. Okay. So the year was 2021. So I had been shadowing with Seth, who already has a backstory, before I got licensed, and I had a little bit of a collapse. I needed to go to the emergency room. I did not have health insurance. I had lost my job. I was in the middle of hustling to get my real estate license, and I wasn't going to go to the emergency room because, as anybody would say in this country, I can't go get healthcare because I do not have insurance and it's going to bankrupt me if I go. Seth assured me it's okay. We got it covered. I have somebody for you. Just go get taken care of. Took me to the emergency room. Ended up meeting Brian, who then swooped in, saved my financial ass with getting me the right health insurance. And I actually had no idea that this whole end of things existed. I never had to worry about state insurance or anything like that because I'd always been insured by my employer. But as somebody who was not insured by an employer, I had looked at the state insurance, but did not know anything about like getting any kind of like credits or getting discounts or like picking the right one. And there was a lot that I learned from Brian over here about, not overpaying for it and getting more of what you need for less money. So that's a whole side of this we wanted to at least bring into the MillenniUP viewer and the average person who has been struggling to find health insurance as part of the budgeting in their daily lives. So Brian, tell me a little bit more about what you do and how you even got into it and how passionate you are about health insurance.
I'm so passionate about health. I'm more passionate about helping people not get, the short end of the stick when it comes to health insurance and healthcare costs. So yeah, I deal with different markets, individuals just like yourself, small business owners, people that are retired as well. But for our sake on this podcast here, I'll talk a little bit more and expand a little bit more about the individuals, because I was one of those individuals at one point. I always got insurance through work, and it was always a pick A, B, C, or D, plan, and they took care of mostly everything and just told me how much was going to come out of my check. The first time that I went to go shop insurance for myself, I'm like, is this real insurance? What is this all about? And I've been in those shoes where it's confusing, and I try not to make it very confusing for people. I ask a lot of questions, just like you guys would ask lots of questions about finding somebody's, dream home or what's going to be realistic for them. And that's the same kind of process that I take is ask those qualifying questions, see what their needs are, help people get credits. There's people out there that don't know that they can get insurance, or help paying for their insurance. They think, oh boy, it's probably going to be $500-$600 a month. When in reality, there's definitely programs out there that can help pay for those things and reduce that cost quite a bit.
I think one of the biggest things, as soon as you had asked me well, what is important to you in health insurance? That's nothing that I ever expected somebody to ask who's helping. I'm just used to like you said, pick A, B, C, or D. There you go. Goodbye. And I was like, well, yep. I have meds. I have this specific doctor. You're like, do you have to go to the doctor regularly or is it only infrequently? And Like asking those kind of like qualifying questions was stuff that like you made sure that like my medication was very affordable. You made sure that I wasn't paying for something I was never going to use. So, I mean, that's things that I guess people don't really think about or think that other people care about. I mean, you're probably up there in the like lesser trusted industries, just like we are, and thinking
Yeah.
that it's just like a scam and you're going to get paid regardless. But that's why you're in our sphere of vendors, because we work with people who actually care about the individual. What are
Right.
some of the biggest mistakes that you see people make when they're first coming to you?
I'll share one recently.
Ooh.
So I was referred to someone who was on Cobra for about a year and a
Oh,
half.
I hate Cobra.
Towards their end of their 18 months, I think they had like 16 months that they paid for.
Can you tell us why we hate Cobra real quick?
I mean, Cobra is different a little bit, whether it's a small group or a large corporation. And all Cobra is just the continuation of your existing coverage, but the full cost to you, not your employer paying part of it. So, you could have been paying $200 a paycheck before or $100 a paycheck before, and now all of a sudden it's $800 a month. And so there was a husband and wife, and it was interesting. The wife continued with her Cobra. Her husband's like, I got this thing through the owner of the business I work for said, talk to this guy. He'll help you out. He sold him a plan, and they went on their merry way for about a year, and they got referred over to me to just take a look because she was coming down to the 18 months of her Cobra and said, I need to pick something up. I looked at her. I asked her situation. I said, okay, you're married. What does your husband have? I said, let's take a look at that just to make sure that everybody's in the same pot. Turns out he did not have traditional health insurance. What he had was something through U.S. healthcare, which I'm not saying is terrible, but it's not a full insurance. It's what's called an insurance. It's like an accident and sickness policy where if you get sick, if you go to the hospital, the company will pay you X amount of dollars per day in the hospital instead of paying for your stay and saying you have to pay $500 a day. So you typically buy those types of plans in tandem with health insurance to, fill in those gaps. But he was paying close to $400 a month for that. His wife was paying over $900 a month for coverage. And after meeting with me, I got them set up with insane health coverage because their taxable income was very low, because she was no longer working and he was, able to write off things for work. I got them an insane plan for probably just over $300 a month. Very comprehensive coverage. They were able to save, I don't know, $8,000 or something like that a year. So that's one of the biggest mistakes I see is that, not every agent is the same. And just like in your industry, not every agent is the same. Some people have commission breath. I don't, because at the end of the day, I want to go to bed and happy and healthy that I did everything right by my client, because I don't ever want that call saying, what did you sell me?
Yeah, it's so funny. I'm the exact same way where I explain to people when I go over disclosures and inspection requests, it's like, I do not want someone calling me and being like, how could you have done that? Like, how could you miss this and like put us in this position? So I can definitely resonate with that. What are, obviously this is a real estate podcast. We're doing, we're branching out a little here, a little change of pace, because what we're trying to do is bring in other resources for people who are trying to like kind of put their life together.
Like giving people the tools, resources, and know-how.
Yes, exactly. In the end, like, how have you seen, and you're a homeowner, and I assume you talk to people a lot about, when they lose their job. Like if somebody like loses their job, like we get that call because they're worried about paying their mortgage. But obviously a more immediate thing is like, we don't have health coverage anymore, or we're going to lose our health coverage. Like, what is the thing that you tell somebody who owns a house or is even renting, but abruptly loses their coverage through their employer? Like, what's the next step other than to obviously call you? But like, what is the thing that you do to triage that situation?
I mean, I guess every situation is a little bit different. Some people lose their job, like especially this year. I don't know what it is. I mean, that trend is typical, but I mean, people just, either have a little nest. A lot of the people, thankfully, that I have talked to have a little bit of a nest egg, but then their expected income might be different for this year. Obviously, they don't know. Some people have jobs that they can easily replace. Other people don't. So it's honestly a case by case basis and seeing what I can do to help them in that situation.
You just mentioned something like around job loss and then a trend. You said it's more of a trend, or it's becoming a trend, or what was?
Yeah,
are you seeing more people? Are you seeing people lose their jobs, or at least changing jobs more? Or talk to us a little bit about your employment.
Last year and this year, it seems like it's been a very big trend. The other trend I see is that people are leaving their jobs and doing more self-employed stuff, which is a lot of people that I deal with is on that trend. Or last year, I had a lady who was working for a company, and all of a sudden they just 1099'd her. So then she had to pick up her own health insurance. So it seems like companies are getting more creative with that and just trying to save their own money rather than doing layoffs. They just do, okay, you're contractor now, sign a new contract, and then they need people like me to help them shop their insurance.
Yeah, so let's talk about that a little bit, because we realtors are all 1099, and we all have to go find our health coverage from somewhere. Right. And I just feel like there's this entrepreneurial spirit of the last 10 years. I think a lot of people from the Great Recession on want to almost plant their own flag, stake their own claim, whatever analogy or cliche you want to use. But what would you tell somebody who does have that W-2 job and they own a house or they've got a family or whatever, but they also want to start their own business, whether it's a side gig or if it's something that they want to just go into? Like, I have a friend who just both of them just left a very safe W-2 job, high income, and they decided to buy a couple franchises. So now they are full-time, or they're business owners, 1099. What would you tell somebody who is going down that path for health insurance? Like, what's their best bet, going forward?
Because like they would be coming from a W-2 job and going strictly 1099, a lot of the premium subsidies and credits are based on expected income for that year. And so they're in a nice, fun spot where, their expected income could be very low depending on what their business expenses are. That's the other big thing too. A lot of people say, when I ask, one of the first questions I ask them is, no one has a crystal ball, but what do you think your expected income is going to be this year? And if they say, well, I don't know. Well, it could be one thing, could be another. And there's different ways that you can apply to be able to get plans through the marketplace that would not be regularly available for somebody who put in $100,000, $200,000 income, because the lower your income is on the application, the more plans are opened up for you. So there's cost sharing reduction plans for people. And that really helps a lot of people that are in that, infancy stage of their new venture, and kind of gives them that peace of mind that their out of pocket might be very limited, that they don't have to spend $8,000 in their out of pocket. They may have to only spend $1,500. And that gives them the confidence to be able to do what they need to do without, it's one less item that they have to think about. The other thing too is that I stay in contact with people, or at least try to, because these subsidies are income based on the year. And if I talk to you in January and you say, okay, it's going to be $30,000, I tell them at that point, all right, we're basing it off of $30,000. But if something changes, if you sell something big, or if you big turn in the market one way or another, give me a call and we'll see what we can do. What your new premium might be, because the last thing I want is somebody to call me when they're filing their taxes and say, Brian, I owe $4,000. What's up with that? So, I just try to educate as much as possible, and kind of wrapping it back, just like you guys, you want to do as much education as possible, for anything real estate related.
Yeah, I think that's something that was helpful, at least in my experience with you. And talking about customization, I feel like your industry, more so even than ours, is one that has more customization that people don't realize. And like, I never knew. So with in real estate, we're commission only. Never know. And when you asked me the same question, like, what do you expect to make this year? I think I just laughed at you, and I'm like, I don't know. Mm-hmm. I was like, it is so like, who knows? I said, I don't know. Like, I could get like 5 settlements in 1 month and then go like 3 months without one. So you were like, well, things people don't understand is that you can pay smaller amounts per month. It's all going to catch up to you at the end come tax time. But it's like, if I get like a big chunk of money come in, I can then just like pay on it then and be able to kind of like pay down the amount that'll be due with my taxes. But you do a very good job at educating that and making sure that it's not a surprise, and that if you take those routes, what the pros and cons to them are, and be able to weigh kind of like what is better for each person.
Yeah. I think one more thing I'll add on that is just I try to put myself in that person's shoes and think of how would I want to be led in this way. I mean, it's just, it's treat others the way you want to be treated, I guess, at the end of the day. But it's just that I want people to have that comfortable feel, because it is such a confusing marketplace for no reason. And I don't want to make it more confusing to people.
Yeah. So I have friends overseas, and obviously, socialized medicine has its downside or whatever, but this is one area where I will openly admit I do not know a ton. I've been very fortunate to always have access to healthcare. I've never had to like go on the open, the exchanges, or have to call Brian Cannon. What are some changes that are coming down the pike here? I mean, you and I are in a networking group. We talk every week, and I always hear that, hey, we got this coming down. You got to get this in by this and this and this. And November, I know November's a big day, a big month, and all that. But for somebody who is under the age of 50, because I know there's like a whole other side of this up top where there's Medicaid and retirement and all that good stuff. But for someone who's under the age of 50, like, what are the big things that people need to think about that are coming down the pike, whether it be related to the election, like politics, or if there's just something that's going to phase out or something that's going to phase in? Like, what can we tell our audiences about that?
There's a few things, every year, and it's 65 is when it goes to Medicare. So anybody under the age of 64 is on this individual market. And, every year, open enrollment is from November 1st through December 15th. In the last couple of years, it's always been extended for some weird reason or another because they have some kind of technical issue. But that is the soup and nuts of it. In 2026, there's something that is expiring. It's the Inflation Reduction Act. That can be extended. But all that really is it's going from how things are calculated now to how things were calculated prior to 2022, I think it was, where right now the insurance can't exceed more than 8.5% of your income based upon the second lowest cost silver plan. It's very confusing. So
my wheels are here like spinning. I'm like,
what is all that?
I'm already confused.
They pick a benchmark plan. Let's say it's silver plan with Blue Cross, right? That costs $300 a month. If your income is less than, I don't know what the calculation would be, but $3,600 exceeds your 8.5%, they're going to give you a credit to make that $3,600 plan only 8.5% of your income. So if your income's only $20,000, then you're going to definitely pay a lot less than that, or a lot less than the $3,600. But the way that it's going to go back to was a bracketed system. So it's anywhere from, I believe, 150% to 400% of the federal poverty limit. So there's going to be 4 different brackets. It's how it was before, where, right now a couple that's 60 is going to have an income, like let's say one person that's 60 years old can make up to $150,000 and get credit towards their health insurance. Whereas somebody that's only 25 might have an income limit of about $38,000. So because people that are 60, their insurance costs more than somebody who's 25. I know I'm losing people here, but
I've been lost for the last 45 seconds. So that's fine.
Yeah,
very good company.
It's essentially going back to a simplified system that's going to screw a couple people. I'll just be honest with you.
Which bracket people are we screwing here?
Yeah, who's getting screwed now, Brian?
50 and over is going to be screwed the most, probably.
Now, listen, it's
Don't get Jen
I have to be
started
careful
on
with what I say.
Yeah,
they can pull
Jen,
the equity out of their like $1.8 million homes that they purchased for like $60,000 and just hush.
Jen's never gonna get a client over the age of 50. I guarantee you that.
Okay, all I'm saying is our age bracket has been screwed enough. Like, help us, give us a little something for once.
Yes, we are very well documented that we're very happy, Brian, that you're saying that people over 50 and not under 50, because I mean then we would probably have to stay on here for another.
I'd be like, okay, it was really great talking to you. Until next time.
I'll add to that. So people over the age of 50 and families, I think, are going to be affected.
Okay, so, right. So it was really great talking to you. Until
so la 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 blah blah blah. No.
Wait, why families?
Why families?
So it because it goes off of household size as well. The family of 4 prior to this Inflation Reduction Act was capped at about $100,000, and now because it's it's age based as well, you could have
like $100,000 for a family of 4 is like that's not that much.
It's not. It's not. So. And those numbers will be higher just because of inflation and the federal poverty limit being higher now than it was then. But a family of 4 right now could make $200,000 and still get a fair amount towards their insurance, and they're going to be losing that. It's going to be affecting them by a couple $100 a month. And it's not something that's set in stone, but it is politically based. So depending on who gets in office, could have a effect on that.
This is not a political podcast, everybody listening. Yes. These are facts.
These are not facts.
These are not opinions. They are facts.
Exactly. But my old adage and rule of thumb is as soon as you give something to people, on the individual market especially, and you try to take it away, there's going to be negative consequences.
Yeah.
Well, people are just going to get upset.
It's the exact reason why Social Security will never, ever, ever.
Yeah. They're going to probably extend it. I don't know. No one's got a crystal ball for that, especially. But
I mean, it's one of those things that people need to factor into their budget, though. I mean, if somebody decides that they want to start taking a business venture of their own, and I know for me specifically, if I were ever to plan to move, I can't for the next 2 years, or at least I'd have to plan for 2 years as 1099, because I'd have to make sure my income would be able to show and match what I would need for qualification purposes. But if you're going to be in the process of planning out your budgets, your finances, your income, and all of that in the next couple of years, somebody wants to buy a house, things that people need to factor in are health coverage and what that's going to look like down the road. So do you think it's safe to say that if it is family of 4 or above, to be able to kind of buffer in a few extra $100 just for healthcare?
Yeah, I mean, I think it would be safe to, and we'll probably know a little bit more towards the end of this year and the beginning of next on what's going to happen with it. I mean, there is also ways that we could just downgrade the coverage too, or take a look at options for kids on CHIP as well, which is a state-based program.
And what I think is great about, sorry to cut you off, but what's great about you helping people and people knowing that there are people like you to be able to help navigate these things and they don't have to do it on their own is you don't get a cut from CHIP. You don't get paid for people going, putting their kids through state paid insurance. But I know you helped me when I was getting mine. And I had Jackson to cover. You set him up on CHIP and you get nothing out of it, but except for me contacting you every month and sending everybody I know to you, knowing that you can sleep at night knowing that I'm covered and my son is covered.
Right. I mean, that's also part of the going to sleep at night and knowing I did the right thing. Not everybody's situation would be best to go to CHIP, but in your specific situation and based upon what we talked about, that was the best situation for you.
So what would make somebody not
larger families typically, because it actually helps pay based upon their income and where that's at, they might actually save money by keeping the kids on their plan versus going on the CHIP. So it's not I don't have a blanket approach to anything. It's
like a big puzzle. I mean, every situation is a little different. It's just like a real estate transaction.
Right.
Yeah, like if I could shake every person who doesn't get like W-2 employer benefits and just tell them to have a conversation with somebody who does this all day, every day, and to not self-navigate it, I would shake them over to you. But it's the same thing I would do to them for talking to like a lender too, or just like any person who can make somebody's life easier. It's like, why do things yourself when you don't have to?
Right. Yeah, and I mean that's kind of the other piece of it too, is that people that are 1099'd and are starting those business ventures, they don't know what's going to affect them when they go to buy a piece of real estate. So that also kind of does trickle into a conversation. Also, pushes over people to an accountant. There's people that are, 1099 that aren't filing taxes properly or the way that they should to benefit themselves. So I don't give tax advice, disclaimer, but
we don't give legal advice, disclaimer.
Or tax advice.
No, I stay away from those, but I can only speak from my own experience. And, when I do help people like that, it's beneficial to them, keeps them, in a sphere of people that I know, like, and trust, and I'm able to, genuinely, provide them some help. So.
Yep. All right. Well, I think we can leave it there. How does someone get in touch with you, Brian, if they want services? Like, where do you cover? We're all Pennsylvania based, but like, talk to us a little bit about how you can best help as many people as possible.
So I am licensed in about 7 states. The closest ones to us is Jersey, Ohio, Delaware, Maryland. Not in New York. New York's just a different beast. But I can help anybody in those areas. You can contact me. I can provide my contact information. I don't know if you guys can put it.
We'll put it in the show notes.
I am coming out with a new website for myself that's going to have some helpful tidbits on there. It's going to be briancannonllc.com. Don't go there right now because I accidentally published it and there's really nothing on it. But that should be coming out in the next couple of weeks. But it'll go over, common questions that I get and different, helpful information, because everybody's looking for surfing the site for some insurance info, obviously.
Well, if it is up and running by the time this gets published, we'll also put that in the show notes.
Perfect.
All right. Well, thanks for joining us, and we will be obviously sending everyone your way that needs health insurance, and have a great day, everyone.
All right. Awesome. Next time.
Thanks. See ya.